Hello, it's CJ. Did you know that January is National Cervical Cancer Awareness Month? So today I want to talk to all of my ladies who have abnormal pap smears and been told that you need to have a colposcopy. I'm going to let you know what a colposcopy is, what you can do to prepare for one, what you can anticipate happening the day of your procedure, and what treatment options might be recommended based on your pathology results. A colposcopy is typically recommended if you have abnormal cells detected on your pap smear. The purpose of the exam is to see where those cells are growing and if they are concerning for the development of cervical cancer. It's done in an office setting and typically doesn't take much more than 20 to 30 minutes. If you have been told that you need to have a colposcopy, here are the 4 things I recommend in preparation for your exam. Number 1, try to schedule your appointment when you are not on your menstrual cycle. Number 2, make sure you are using an effective form of birth control for 2 weeks prior to your procedure. You can still have a colposcopy even if you're pregnant. However, your provider won't be able to do all the necessary biopsies. Number 3, an hour before your appointment time, make sure you take some form of a pain reliever, such as ibuprofen. The colposcopy itself doesn't hurt. However, if they need to do biopsies, those can be pretty crampy. And number 4, in all likelihood, your provider will need you to do a pregnancy test prior to the procedure. So if you get to the front desk and you are doing the pee-pee dance, ask for a cup. On the day of your procedure, after you do your pregnancy test, the nurse will take you to an exam room. You'll get your bottoms off and they will cover you with a sheet. Your provider will come in, they will explain the procedure, and have you sign consent forms giving them permission to do the colposcopy. After the consent forms are signed, you'll lay back on the table, put your feet in the stirrups, you scoot your booty to the edge of the bed. They're going to put a speculum into your vagina and look at your cervix with a standing microscope. Then they're going to put vinegar on your cervix. The vinegar actually makes the abnormal cells glow white. Some people say it's cold, some people say the vinegar stings. Most people say they don't feel anything at all. After the vinegar has been on your cervix for about 1.5 minutes to 2 minutes, they will look again with the standing microscope. If there's any areas of concern, your provider will probably want to do a biopsy. The amount of tissue that they take is no more than a grain of rice. However, your cervix does not like to be bothered, so you may feel a pinching sensation or a cramp in your uterus. Because your provider cannot see inside of your cervix, they also may do what's called an endocervical curettage. They're going to take an instrument, scrape the inside of your cervix, and gather up the cells. I am not going to lie, that part can be really, really uncomfortable. Thankfully, it only takes a couple of seconds. They will send all of your tissues off to a pathologist for further evaluation. Those results should be back within a few days to 2 weeks. If your cells are noted to be mild, low grade, you'll also hear it called CIN1. You'll probably just have a repeat pap again in a year, just to make sure that those cells go away. If your cells come back moderate to severe grade, or you'll also hear it called CIN2 or 3, your provider might talk to you about having those cells surgically removed, or depending on your future fertility plans, they may recommend a repeat colposcopy in 6 months. After the procedure's over, you are going to be cramped. I recommend taking pain relief and putting a heating pad on your belly. You may have some bleeding. You may have some discharge that's brown or black in color. If you are running a fever, having foul-smelling vaginal discharge, if you have pain that is not managed by ibuprofen or bleeding heavy enough to saturate a pad in an hour, please call your provider right away. What questions do you have about colposcopy? I hope you'll leave those in the comment section below. And while you're in that comment section, I would also really appreciate it if you'd hit the like button.
Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.